And personally, for me, if I paid attention to these signs and symptoms, I could have saved myself a lot of hair loss. When it comes to CCCA, scarring alopecia, for most of us, we don't go to bed with a head full of hair and then boom, wake up the next day, Mr. Clean, smooth, shiny, bald head. That does not happen for most of us. The signs will be there. And in many cases, the signs will be there long before we actually decide to go and get that official diagnosis. Not trying to freak anyone out, but again, taking action early on can make a huge difference. So if you notice any of these signs and symptoms, it doesn't hurt to just go and talk to a dermatologist or a trichologist and get a professional opinion. The first symptom that I started noticing was very dry and brittle hair in the center of my scalp. I will wash my hair, do the deep condition, do the hot oil treatments, all that, and within a day, my hair would feel like a Brillo pad. It was just abnormally dry. The second thing that I noticed was very tender scalp. It almost hurt to touch my scalp in the center. It was very red, very inflamed. That was the second thing that I noticed. And when I noticed that, I was like, okay, something's not right, but I still put it off for a little bit. The next thing that I noticed was very itchy scalp. I never had the urge to scratch my head as much as I did in the early stages of my hair loss journey. It just itched really bad, uncontrollably. And the last thing that I noticed was abnormal shedding. At some points, there was more hair in my hand than there was on top of my head. So I just knew something was wrong. I could gently tug on one strand of hair and it would just completely fall out. So I noticed these things and I kind of let them ride for a little bit longer than I should have before going to seek help. But eventually I went and talked to someone, and yes, I was diagnosed with CCCA, scarring alopecia.